COVID-19 pandemic, and especially the effectiveness of social distancing measures, as well as how we could use data in a useful way to fight the virus. The implications can be multidimensional, and I'm very happy to have on board Professor Alexander Penland, is professor at the MIT Media Lab, and who directs the MIT Connection Center. We have also Esteban Moreau, who is visiting professor at the MIT Media Lab, and also associate professor at the University Carlos III of Madrid. Sandy and Esteban, they have some joint research on the effectiveness of social distancing measures. And we are also very happy to have on board in this event Sven Smith, a senior partner at McKinsey and Company and co-chairman at the McKinsey Global Institute, which is quite active in research on the dimensions, of the different dimensions of COVID-19, including economic dimensions, and including also on some research output, some key output on the implications of the imposed measures to fight COVID-19. Welcome all on board. For the audience, let me mention that today's event, it will be around 60 minutes, and it will be divided in two parts. The first part, it will be the part of the presentations by our guests, and the second part, it will be the part of the discussion that will discuss associated issues. You are very welcome, and we're very happy to have your contribution in the discussion. How can you contribute? You go to the Slido platform. You can find the link below the live streaming. You use the code #distance, and you join the platform to ask questions for this event. When we will go to the second part of the event, I will be checking Slido for your questions. Please feel free to post questions there, but also like the questions of the others, the most popular questions will be on the top and will be the first I will look. Without further ado, I will give the floor to Sandy to share his insights on the world of data and how it can be useful to fight COVID-19.
Great, thank you very much. Let me start my slides here just to get things going. And there we are. So my name's Alex Penland. People call me Sandy. Run a group called Connection Science at MIT, which cuts across all of the departments. And as it says, we're 32 researchers, faculty, staff. And we've been involved in discussions that kicked off GDPR, the Sustainable Development Goals, where I'm on the board of directors of the Global Partnership, and work closely with EU official statistics framework for Eurostat. And I thought it would be useful to be able to talk about how people handle data, maintain privacy, maintain compatibility with GDPR, and beyond in doing many of these sort of analyses and moving forward to restarting the economy. So the core question is how can we avoid Big Brother, this sort of surveillance all the time? And the key insight is that what we often think about doing is concentrating data in one place. And that's a mistake. As humans, you know, we have to like organize our data, get it all together. But computer networks are very different. You can send questions to computer networks. And rather than sending data, you send code or questions to things. And that code can be something that is approved beforehand, that you can analyze, that you can audit to make sure that the questions are good ones and that the answers that come back have no individual data in them. And so the computer architecture looks like this, is that the person asking the question has to present who they are, what the question is, their identification so that we know it's the right person, have permission to ask, we know what the question is. That gets logged in a ledger so that it can be audited. And then instead of moving data, you run these questions wherever they're collected. So if you want to know, is someone older than 21 years of age, you may ask the birth registry, how are they older than 21? And rather than giving you back their age, they give back the answer, yes, they're older than that. But even further than that, that's called data minimization. Even further than that is we don't allow questions about individuals. We allow questions only about groups of people that are anonymous. So you might ask, what is the average age of all the people in a neighborhood where there's a fairly large number of people in the neighborhood? And that's an aggregate anonymous data, which the data protection authorities have ruled are safe for being used in many of the applications that we're going to talk about. And it's also very similar to the sort of principles that have been used successfully in Estonia for many years, and which we've worked with Eurostat to make the official statistics in Europe conform to this sort of privacy-preserving data localization methodology. And Esteban's going to show you some of the things that you can do with this, because one of the first questions that comes up is, can you do anything with this? And the way to think about this is that what you're doing is something that's like census data. You're saying for the people in a neighborhood, where do they work? Where do they buy groceries? And maybe what is their average income? Right? And so it's very much like census data, but it includes these sort of patterns of behavior of aggregates. So there's no individual data in it, but it tells you how people, and therefore infections, spread throughout the city. And that's the sort of thing that Esteban's doing. And there's various mechanisms for doing that. You do the computation locally with a data holder. You have legal contracts that make sure that no one has the ability to do anything that they shouldn't be doing, etc. An example that I would like to sort of focus on, other than what Esteban's going to talk about, is immunity certification. So we have to restart the economy, and we have a sort of hidden resource, which is people who are immune. They've had the disease, they've gotten better. And we see already large-scale immunity testing beginning to happen. It's not quite there yet, but it's beginning to happen. And these people are relatively safe to have in sort of frontline positions. So they can push carts in hospitals, they could give out food at grocery stores. There's many places where they would come in contact with people, but because they've already had the disease, they're much safer than a normal person. And in addition, the people that have had the disease are disproportionately younger, lower wage, more likely to have lost a job. They're the people we want to help the most. So this sort of thing would go a long way towards remediating the fact that the younger, lower wage people, the people in ethnic minorities, have been disproportionately slammed by this. People say, oh my gosh, a certification, what is that? Well, historically, we had certification for tuberculosis. So food handlers had to show that they had been vaccinated. You still have that for schools. Kids don't show up for certain sorts of schools or teachers without certifying that they're vaccinated. And you can do the same sorts of things with safe workers. It's not unusual in our society. It's fairly common. And that's a great way to sort of help the people that have likely lost jobs, are disadvantaged, to get back and reboot things. Now, the problem with this, of course, is that if you had these one big database of things, that begins to be scary from a sort of big brother point of view. And we can take as an example of how to do this, what we do already for financial transactions. So in addition to privacy, there's data control. In many countries, you really don't want to allow the government have a single database because the police, other people will use that database for purposes it was not intended for. So you'd like to distribute that data. In the case of money, when you buy something using a credit card or a mobile telephone, what happens is a identity provider, like for instance, MasterCard in the case of purchases, sends a request to your bank, and it's your bank that certifies that you have enough money. So it's not a global database. It's the people that you've given permission to, your bank, being able to say, yes, this person can buy that. And MasterCard is not allowed to look at that data. They merely facilitate the transfer of the data. And then that goes to the merchant that you're trying to buy something from. And you can imagine a similar type of thing where when you want to say, yes, I'm immune to this disease, that sends a message to the hospital where you checked in, where you got tested, where you were sick, and they come back and they say, yes, he's safe. And nobody can see that message in the handling part of it, right? But the employer, the hospital, the whatever, can verify that you, in fact, are immune to it. So there are ways of handling data that are distributed, that are aggregated, and therefore safe not only from a GDPR privacy point of view, but are highly resistant to bad actors stealing all the data, the government misusing it, and so forth. So I wanted to start with that just so that we're sort of on the same page here. And I'll turn it over to Esteban now.
Thank you, Sandy. Yeah, Esteban, I think that was an ideal introduction on how we should use data to avoid some unintended consequences, bad consequences like the big brother kind of state. Let's go now how we can use geolocation data in the context of COVID-19 and social distancing measures.
Okay, thank you. I think you can see my slides here.
Perfectly.
Okay, so I'm going to talk, like Sandy said, in our group, we have been working closely with the different data providers to try to reach, try to find what is the perfect aggregation of the data, the perfect level of description of the data, that so we can produce this, what we call this rich census data, in which we have not only the information that the census have, but also information about how people flow between areas, how people visit different areas. And one of the specific examples in which we have been using this data is obviously what is happening right now with the pandemic. And I'm going to concentrate on this curve that you probably have seen in many places, which is the current situation right now that we have with the pandemic is that we have two phases. One is the hammer and the other one is the dance. The hammer is basically what is happening right now is that we are having probably the largest intervention that has been in our society by forcing people or preventing people from getting outside and social distancing themselves, or even having strict mobility restrictions, like, for example, in some of the countries in Europe. But eventually, once the curve of infections and people going to the hospital and unfortunately people that are dead, goes down, then we will have to reconnect our society. That there will be another phase, what people call the dance, in which we were going to have probably, before we have pharmaceutical interventions, we are going to have probably to have contact tracing or targeted quarantine, or we have to ban larger gatherings, etc. So we have to actually prepare ourselves and the society and our economy to how we're going to do this, the last part, this dance. So I'm going to show you what aggregate data and completely anonymized data can tell us about how these two phases could work, how actually the hammer is working, and how the dance part could work using this data. So the first question is whether the hammer is working. I mean, like if people are actually abiding to the rules, and what are the groups which can actually do that, and groups which cannot because of their, I don't know, economy or the economical situation, family situation, etc. So we have been using this location data that is aggregated at the level of census tract, in which we can, for example, see how what is the typical distance that people travel every day. This is our first report for New York City. And here you can see polygons there, which is basically each census tract. So we aggregate the average distance that people living in that census tract travel per day. On the left, you have a normal, let's say, before the lockdown day, weekend, sorry, which is the 6th of March. And you can clearly see that people in urban areas move less, people in the suburbs move more. The average distance they typically travel is about 50 kilometers. But then once the lockdown was introduced, you can clearly see that everything went dark, meaning that people are actually moving right now only about 10 kilometers per day on average. So you can clearly see that most of the areas in the New York City are actually abiding to the rule, and they are actually social distancing themselves. We can also see that this happens also at the level of contacts. So we can see where people are visiting a place, and then we can detect whether they are close in proximity, in distance actually, less than 25 meters. Once again, the data that we have is aggregated at the level of places, so we are not tracing anybody here. And you can clearly see that before the lockdown measures, the number of typical contacts that a person has in New York was about 75 to 100. And especially during the weekends, there was a peak because people go out, they go to the movies, to the restaurants, etc. And after the national emergency, the schools closures and the non-essential closure, the level of contacts have decreased to minimum. And actually, the good news is that actually people are still social distancing themselves. So it's something that in New York City, at least, after the non-essential closure measures, people are actually abiding to the recommendation, and that's very good because these 2 weeks of maintaining this low level of contacts is going to help in the future in the pandemics. But that's actually, although the number of contacts is actually very small, and that's good, still there are some places in which this number of contacts is huge. And I'm showing here, which is a fraction of daily contacts that are happening as a function of time. And most of the contacts that happened before the lockdown measures were happening in food places and in shopping. As you can imagine, most of the people were going to restaurants or to, for example, shops, stores, and most of the contacts, most of the proximity, let's say, between people were happening, proximity events between people were happening in food and shopping. But then after the national emergency and the lockdown measures, most of the contacts right now are happening in groceries. So that means that although the number of contacts is very small, what is happening right now, the trench right now where the remaining contacts are happening are the grocery stores. So we should focus probably our policies and our interventions in the future in the grocery stores, because this is where probably the residual contagion is happening right now. Of course, the food is still important, but the groceries are probably the ones which are more important right now. So yes, the hammer is working. People are actually behaving themselves in terms of social distancing, but still we have a lot of the residual contacts happening in groceries. The other thing that we have been looking at is that social distancing have very different effects in different groups. And I'm showing you here, which is effect of mobility of the different demographic traits that people have. So we can see, for example, that basically the bar to the left means that people that have this demographic trait are moving less than previously. And the bar to the right means that people of this demographic trait are moving more than before the pandemic. Not before the pandemic, but they're moving more than the average. You can clearly see, for example, that household size matters a lot. So people that are in household sizes of 2 or 4 are moving more or less like the average. But the people that have household size equal to 3 are actually moving moving more than the average. The household is actually of size 3, okay? Sorry, this is actually the opposite, it's moving less. So the people that have 1 kid, for example, are moving and staying home more than people that are having household size 4 or 2. The other thing is that people that are actually were using in the car or the public transportation are actually moving more right now. So that's actually, sorry, there's the way around in the plot, are moving more. And the people that have educational levels and income which are higher are moving actually less than the previously. So different income groups and different education groups and even different household sizes have different impact, and they have on the mobility, the social distancing have had different impacts. So we have to keep in mind that this social distancing is affecting different people at different levels. The other question that we also have addressed using disaggregated mobility is what is going to happen in the dance part, whether we can tell something about which groups or which strategies are going to help us in the dance part once the number of contagions and the number of infections is very low, how we can reconnect our society. One of the things that I will like to stress is that the models for the COVID are really complicated. So you can see here, this is the epidemic model that people in the WHO, the CDC are using right now, in which there's a lot of buckets, there's a lot of states, and you can be in the infection. You can be S, as susceptible, you can be in the latent state L, you can be pre-asymptomatic P, you can be infected, and then you can be in the hospital. The important part for reconnecting our society, obviously, is the economic part, but at the same time is this part in the plot, is the people that are going to the hospitals. And we want to manage that the people that flow into the hospitals through the ER are actually the minimum. So the burden to the health system right now is minimum. So the mobility data that we have in an aggregated way can actually inform about how is the movement of people, how we can reconnect the different layers that we have in our society, workplaces, restaurants, theaters, other venues. So we can prevent that the people going through this red area that I'm seeing out here is the minimum. And we have tried many different strategies. For example, I tried to reconnect only restaurants, tried to reconnect only schools. Probably the schools are not going to be reconnected until September. We can reconnect, for example, only workplaces, only essential workplaces. And I'm not going to summarize all the strategies that we did. I'm just going to summarize one of them, which is basically social distancing, I mean, the hammer. And after the hammer, we actually reconnect the workplaces, and we start doing contact tracing on only 20% of the people. The contact tracing means that every time you have symptoms, you have to stay home and you have to quarantine your household. But only 20% of the contacts of that people that have symptoms have to be also quarantined. So that is very important to understand that contact tracing, if it's going to work, we should probably assume that it's not going to be used by everybody. Probably there's going to be some, I don't know, problems with the technology. So we cannot assume that the contact tracing is going to work for 100%. But the good news is that our simulations show that 20%, just with 20% of the people following the recommendation of the contact tracing app, we can actually load the number of infections. So the beds, which is this dashed line that you can see here in the upper top, in the right top plot, the number of people that go to the beds in the hospital is actually maintained below the threshold, at least for the Boston area. And finally, I would like to address one of the questions that we have been working a lot in our group is that if we are going to do the dance, probably you have to consider that this is a multidimensional problem. So it's not about just about the number of people that are going to be going to the hospital because they got infected, but it's also going to be about the economy. And one of the aspects that I will like to stress here is also about the inequality in our society. I like this plot because this plot, there are two plots here. One on the left, this was the normal thing in the past. And then we have something which is happening right now, which is on the right. In the left, you can see what is the GDP as a function of the population in the different cities in the United States. You can see that the GDP grows super linear with the population. So that means that GDP depends on the density. The GDP depends on getting us together. So there is something about getting us together in big cities that actually produces more GDP, more patents, more innovation, and that's good. But on the right plot, you can see that actually the spread of the COVID is also proportional to density. Okay, so the big cities are going to be impacted more by the COVID than the small cities. So we should balance these two things. We cannot actually shut down our society because there is something about getting together. But the problem is that getting together accelerates the spreading of the city. So we should maximize social capital, which is maximize the contacts, and we should minimize the propagation. So just keep in mind that these two forces in our society, we are going to have to play with these two forces or these two effects, which are the counterbalance themselves in the dance part. And the final thing is about segregation. We've never been more segregated than today in our society. And the reason is that we are staying in our places, in our homes, in our neighborhoods. So we are never been so segregated as today. We have a research in our group that working about what are the places that actually create more integration in our society. And those places are theaters, entertainment, schools. Well, schools probably not because they are more segregated, but sports, restaurants. Those are the places we create more integration in our society. And all these places are shut down right now. So if we are going to reconnect our society, we probably have to think about how to reconnect, obviously our economy, obviously our workplaces, but also how to reconnect those places that create more integration and more social capital in our society. And I will leave it there. Thank you.
Thank you very much, Esteban. I mean, I think there are very interesting and important insights that goes to many dimensions on inequality, as you mentioned. The relationship between population density is also very important, especially if we want to address also the economic impact and the implications it has to GDP. Before I go to Sven, one question. Social distancing measures can work, especially if they are combined by some form of contact tracing. Does this imply that we are able to see the exit from this lockdown situation, and the fact that when we exit, we need to be more proactive in contact tracing to avoid the risk in the future to have a second wave, a second outbreak?
Yeah, so if we don't do anything after this first wave, there's going to be a second wave, unless we have pharmaceutical interventions, which is, if we have the vaccine, then there's gonna be. But I mean, the chances that we have a second wave is 99 point whatever %. Okay, so we have to do something after the first wave. Probably we have to do more target quarantine. I mean, not like what we have right now, or contact tracing. So our simulation shows that our models show that if we reconnect our society, there's going to be a second wave. But if we do this by using other type of measures, like for example, quarantine, targeted quarantines or contact tracing, the chances that we tame this second wave are high.
Thank you, Esteban. Sven, important implications that are also related to the economic impact. You have monitoring the situation very closely. What are your insights?
Yeah, I think, Georgie, I think you guys or Katja would share the slide. If you go to slide 2, and I'll start while you're doing that.
Could you, Esteban, share again your slides and go to slide 2?
Yeah.
My slides, it was my slides.
No. Sorry. I thought you wanted to comment.
Yeah.
Sorry, Esteban. Katja, if you could upload the slides, it would be great.
So I will start while that's happening. Thank you so much for having me. It's a privilege to talk. The virus is, of course, getting closer to all of us. Here in Europe, where I live, you know people that have corona, you know people that are in hospital, and you know people that have passed away. That's how close it is because of the exponential growth. We've just been looking at the measures of social distancing and also the tracing things that are very important in the future, because we've been studying, of course, as a society, the whole effort to suppress the virus, which is the flattening the curve, the hammer and the dance that we just went through. What we've been studying is, besides this impact on our lives, what's the impact on the livelihoods that are happening here? And as this is being shared, we see basically associated with the lockdowns a very, very significant economic shock. So on the top end of this curve, you see the flattening the curve effort, which then also says, let's expand treatment and testing capacity so that we can handle maybe a little bit more, but also the search for cures that was mentioned by Esteban. But what we find is that when people are in lockdown, whether they have a job or not, actually, it's not so much whether you have a job or not, or whether you're furloughed or not, people stop spending. They stop spending discretionary spend to the tune of 40 to 50%. 40 to 50%. Exports and imports start to jitter as they are impacted, and investments start to jitter. As a result, we see in the Western world, but this has happened in China too, and in Korea and Japan, in the moment of the lockdown, there is a 8 to 13% drop in GDP. 8 to 13% is the single biggest drop in GDP since World War II, and it's bigger than the first quarter of the Great Depression. So governments, of course, have realized that as a result, the largest amounts of stimulus have been thrown towards the world. Even Germany starts with 10, and the US is heading towards north of 30%, to support people and businesses affected by the lockdowns, because it wasn't their fault. We are in the process of preparing to get back to work safely. And I think, Esteban, you were touching, and the tracing was also touched by Alex, that has to do with that. And then we need to prepare to scale the recovery. In this environment, we see the following scenario matrix, and we'll put the numbers to it in a moment. If you go to the next page, please, Katja. The scenario matrix, in our view, has two dimensions. One is the effectiveness of our control of the public health response, and the other one is the effectiveness of the stimulus measures and support measures to cushion the blow of the economic shock. And on the vertical axis, with epidemiologists and looking at the patterns across the world, on the top row, you see kind of the early Asian country pattern, which is the lockdown until you're all the way down and you start to open cautiously is kind of 2 to 3 months. And then I want to remind again, it's because of what Esteban was saying, the virus is still around and the immunity is low. It's cautiously opening. If you look at how China opened Korea, the procedures and controls and the tracking and tracing and testing is super intense. I think Europe and the US does not fully internalize just how intense it is. But that's sort of the first scenario. The second scenario is it takes a bit longer until we fully lock down, and the virus at least comes back regionally. You know, maybe not with a full second peak, but it keeps bouncing around. And the third level would be we actually fail to contain the virus. You get big second and third peaks. And you're basically only time bound by a cure and a treatment. What I'm hearing from the global pharma CEOs on the vaccine, we will get first vaccines maybe in 12 months, but we only get to scale in 18 months. On the cure, we get there between 6 and 12 months, but maybe there's a wild card that we get a little earlier. But you have these three scenarios on the virus. The good news in Europe and the US is now that we see that the Western style lockdowns at least are effective too. And we have evidence in Italy, in Japan, Northern Europe, and even New York, that there's plateauing and dropping of the number of cases coming into the hospital, which means we're somewhere between the first and the second row in the Western world, catching up with the Asian countries. But then if you think about this enormous economic drop that we talked about, and you then look at the policy response with the monetary response that is 10 to 30% of GDP, the question is that response effective in cushioning the blow? And here's the problem. If you give an American or a European $1,000 per person or $3,000 per family, when they're furloughed or unemployed or affected otherwise, will they spend it or will they save it? Well, the evidence so far is they will not spend it. The only moment consumers and customers come back to life, if you want, to ordinary lives, is the moment they feel comfortable that there's a path to get their lives back. And to date, they don't. Actually, absenteeism in factories that are working today is going up because people are afraid that what they're hearing from their friends that are not working, that this virus is actually dangerous. And so we see a huge effort ahead of us to actually make people confident that you can go back to work. And when they're confident that there's a path back, the economy might also come back. It's actually not the stimulus that drives it, although it's helpful that it supports. And we're living in one very special moment. This is the one time that economists agree. I have not seen this level of agreement among economists in my lifetime. They all believe a good support here is needed and the stimulus is needed. In this matrix, you can then see V-shaped, U-shaped, L-shaped scenarios. And we see as two central scenarios, A1 and A3. A3 is if we knock it down fast and we cautiously open, and maybe we go down this single biggest shock since World War II, and it takes us 6 to 8 months to get back up, to basically get back to level. A1 is much uglier. It goes down 10, and it takes 3 years to go back up to the level that we are. When we polled executives over the weekend, and we released a report on that today, you can find it on our website, 36% of executives vote A1 as their primary scenario. Yeah, so we won't control the virus fully, and the interventions on the economic side are not fully. So that's down 10, takes 2 to 3 years to be back up. Down 10, 2 to 3 years to back up. That is very, very deep, very significant. A3 gets about 16%. But what surprised me most is 40% of the votes are in the B scenarios. 40% of the votes are in the B scenarios. B3 and B5 are very small, 3 and 2%. But B1, B2, and B4 are all north of 10%. So there's something like a 25% impression that we will not be helpful with the stimulus. And there's sort of a 15-ish, 18-ish impression that we will fail with the health interventions among executives across the world. If you go to the next pages, I'm just going to illustrate how these shapes look. So this is the shape of A3, where you see China is already coming out a little bit, but will stay underwater till Q3. And US will come back in Q4, and the world will maybe come back in Q1, and Europe a little later. But you see the lines, and it's a super deep drop, but you get back in 6 to 8 months, roughly. Call that the V shape. The other shape is the next one. If you go to the next, thank you. You see China doing roughly the same in the beginning, but then doesn't go back up that much because they are dependent on the rest of the world, and the rest of the world stays under much longer. And much longer is basically you're back in numbers like 2021, 2024, 2022, and so on. So it's much longer. And we're still only processing what will happen in India, Africa, and Latin. That's not, that I think is from an information perspective, not perfect yet. And what I wanted to bring to life with that is that the intensity of our effort to safeguard lives should be equal. It's not an and or an or, as the intensity to safeguard our livelihoods. Because at a shock of this level, it will impact lives too. And while we were working this material, the Wall Street Journal had an article that said, maybe we face the dilemma to choose between lives affected by the virus and the lives affected by the economy. We don't see it as a dilemma. And by the way, the Wall Street Journal wrote differently about it a week ago also. We think this is an and. We need to both time box the virus and time box the economic shock. Because this is an economic shock of such proportion that what I see executives do in this world right now is very severe. I know, if you're an airline executive, they're not flying really. And that might take a long time until we feel that we can go back into a plane. One little highlight, Emirates today had an announcement that they have testing, whether it works or not, I don't know, but they have testing that in 10 minutes or something that could allow you back on the plane. But that's just one experimentation. Until we have that full scale, that will take some time. And the one thing I want to maybe highlight is if you go page 9, I was not going to go 2 more pages, then I'll just pause. 2 more. One more. Yeah. We see many, many executives and their teams working on a crisis team that works on work from home, business continuity, support to their clients, and supply chain. Supply chain is very big in these times. We start to talk to our clients about launching a plan ahead effort on top of the crisis team, because we believe that if a shock of this nature, which is a very rare shock from a health perspective and a very rare shock from an economic perspective, you need to not only plan ahead for what will happen in 2 or 3 years, but you actually need to plan ahead what happens in monthly timeframes. And in those monthly timeframes, we see strange things happening. Some companies will go illiquid before the summer. Large companies, not small companies, large companies. SME, very hard. The other hard part that people need to think about is if, what Esteban was suggesting, and I'm suggesting, opening up is not so easy, and you only open up partially, many companies don't work at 40% utilization, capacity utilization. They don't work. They rather be closed than open at 40% utilization. And so the problem that is ahead of this is really humongous. And we suggest that while we suggest company by company, institution by institution, country by country, to plan ahead to resolve for this economic event, hopefully make it better, while we're also resolving for the virus, it is the imperative of our time to do both at the same time, safeguard our lives and safeguard our livelihoods. This shock is too big to go sequential.
Thank you, Sven.
Yep.
I mean, I think this is a very comprehensive picture of what can be the effects. Sandy, you want to react, please?
Yeah, one thing about trade-off between economy and lives that people often get wrong. For instance, I think that the Wall Street Journal one got this wrong too, is there's immediate lives lost because of economic depression, but there's long-term effects. There's depression. It's not just suicide. It's kids that don't have opportunities. And there's a lot of, it's complicated. So you can't make numbers about it that are really precise. But it's entirely possible that the number of deaths that come from economic shock will vastly outweigh the number of deaths from the disease directly. It's hard to know, but it is lives for lives. The other thing is that I think we're beginning to see is that in the discussions that we've talked about it as a population. In fact, you can imagine segmenting this, and this is this notion of identity. There are people who are largely immune, at least for a short period of time, and they can be utilized differently than people in general. Young people have very different risks than elder people. And so different policies may need to happen in different risk categories. And when you begin doing that, you see that there is now a sizable population, not huge, that has very low risk because they've already had the disease, perhaps asymptomatic. There's another population which has to do with young, very healthy people that has quite a low risk. And they need probably different policies, particularly when you look at long-term, like for instance, college students entering the market right now will have lifetime hits in terms of economy, life expectancy, but they're in fact generally at much lower risk. And so opening up ought to segment the population by risk, not only by geography. And so far, all the policies we have don't do that.
Thank you, Sandy. We have a couple of questions. Unless there is a further remark on that, we can start around for questions for all of you.
Yeah, sure.
So I will ask one question to each of you collectively, and then I will give you time to respond. So for Sven, one question is, as Esteban mentioned, second wave should be expected. And of course, you need to be ready for that. I mean, Esteban mentioned about Garadin measures that they are here to stay to some extent. Sandy mentioned this immune certification that could be helpful. So does your analysis take into account this possibility on the impact of the virus or not? So that is the first question. Let me go also to the questions for Esteban and Sandy, and then Sven, I will give you the floor and we'll have a round on answers. So Esteban, the question for you is about the population density and GDP growth. What does the density drive GDP or the opposite? So what is the causality behind that? And a follow-up question that is related is whether the fact that we entered to a new reality where distancing is exercising can also lead to, let's say, a divorce between density and GDP growth as a positive relationship. And for you, Sandy, the question is about the immune certification. There are some cases of reinfection reported, for example, in Korea, South Korea. How this certification, immunity certification, can be helpful if reinfection is possible. So let's now go to the answer, starting with Sven.
Yep. So thank you, Jojo. I just want to start with my country today released what I think is quite unique data, which is that they actually did population level research in blood banks on how many people have antibodies, based on the blood. The number is quite low, it's 3%. We're actually quite effective in flattening the peak, so the hammer that was described, but 3% is very, very low, which basically means we have no addition. Our immunity is very low. So I think we're very much in Esteban's territory of potential second peaks and so on if we don't release cautiously. And this intensity of how you do this, I think, is very, very important. What I will say is about the second peak is by the time the second peak might be big, I don't know what the timing is because that the virus will dictate that. Innovation will have progressed. The one thing that is very special about this moment is the level of innovation that is thrown at the planet at the moment. I've never seen in my lifetime too. It's innovation in vaccines, in treatment, in hospital capacity, in what the best treatment in hospital is, in ICU capacity, ventilator capacity. And I can go on and on and on in the flow of patients through the system. Also innovations in distancing. If you look at China, they had 5 refs on getting to the appropriate protocol that kept distance and separation of segments and quarantines and so on. 5 refs of innovation. That learning is coming across the world and we're going to all learn about that. So I hope by the time second peaks come, we'll have more hospital capacity that can deal with it. We will have better treatment and all that kind of stuff. And we will have better tracing, we'll have more testing and all of that. We'll have better procedure and protocols, so we will handle this one better than the first one. Our readiness for the second peak, as one, I don't know whether you agree, but is much higher than our readiness for the first peak. And that is at least my hope that this innovation machine is upping our readiness, not on an annual basis, but on a weekly basis. Just look at the amount of testing in the US. It went from nothing to close to 1 million. And keeps on going. So this innovation engine should not be underestimated. It is actually one of the most beautiful things that are currently happening while this is a sad moment, just to be clear.
Thank you, Sven. Esteban?
Yeah, so about the question about density and GDP growth and innovation, etc. So there are, of course, this is the final result, and like density is correlated with the GDP growth and innovation, but underneath there are many causes that are created by cities. We also in our group we have been looking at, for example, which are the skills that are developed in different cities, the type of jobs, the labor markets, etc. Everything seems to depend on the population. So having more population means that you have more specialized people, more people with what we call high skills or more developed skills. So yeah, I think in general, the agreement is that the larger the population, the more specialized work institutions and also society becomes, and that creates more innovation. So there's a causality there. Although underneath there's a lot of steps that drives that causality. So not every city that has the same population is actually ends up in having the same kind of GDP growth. So I think we have to revisit that idea, like a physical proximity means, or that we have to revisit let's say the underneath reasons why density is related to GDP growth. And I think we can still grow and have GDP growth, but not being physically in the same space. Most of us have changed dramatically the way we work right now, but we are still working. The results of these experiments probably going to show up in the following months, and we're going to see whether some sectors are, as Ben was saying, some sectors are going to be dramatically changed because physical proximity is required for them, like working in factories or services, etc. Some of them are not going to be affected by that. So the question is how we can still be connected, like I was saying, maintaining the social capital while not being physically in the same space. So I think the key question is how to repurpose our workplaces, our areas, our neighborhoods, even, for example, the way we shop. So we still share the same space, but we are not at the same time in the same space.
And by doing that, it may be the case that this new way of doing business, of being in a relationship from distance, is something that we will see it in an increased level even after the pandemic pass, right? So that is, so some of the effects may remain longer on how to do business. Sandy, your reactions to what said, and also the question about reinfection and immune certification.
So to sort of follow on the thing that I was saying earlier, you need to sort of restructure things so that they're more resilient. Regardless of this disease, there'll be others. There'll be other things like this. And so we need to have a way of organizing ourselves that's much more resilient, even when we miss the occasional thing, because we will. All tests have false negatives, false positives. And so you have to have sort of layers of defense. One layer of defense is that you minimize mixing across broad ranges of population. So today we actually have some of that. You know, we have some physical working conditions. A lot of things are virtual. You can imagine a hybrid where neighborhoods become something where you can shop locally, but other than that, it has to be online. And what that would do is an outbreak could be contained locally, where you have a lot more sort of eyes on the process. In an organization, it might be that senior members are much more virtual than junior members. And the junior members are much more localized, so that if somebody does get sick, it's only that local area that gets hit, and you can bring resources in. So there's lots of ways to get resiliency. You have to acknowledge that we're not going to beat it. It's not going to go away completely, period. And if it gets very low, there'll be new ones. So we need to organize things so that when infections happen, they're minimized, they're tracked, they're taken care of, and that they spread as slowly as is possible so that we have a greater chance of finding them. I like to joke to people that people like WeWork were a couple of years too early. If you could have much more sort of local working conditions, then the disease wouldn't spread across whole cities at the same rate. And the evidence about creativity and innovation suggests that you don't need having physical proximity all of the time to get those effects. You need to have social relationships. You need to know people. You need to trust people. And that can come from occasional interaction rather than everybody driving into the city every day. So you can probably get a nice blend of this sort of trust, interaction, and containment at the same time.
As Sven mentioned, immunity is a very low percentage in some countries. We also have the possibility of reinfection. Would that mean that this, let's say, pandemic crisis will prolong for a very, for several months from now? What are your expectations? How do you see yourself in the end of fall, for example? Do you believe that we will be in the same situation or things will be better?
Well, I see an amazing rate of innovation. Boston's sort of the center of the biotech industry in the world. And it's just incredible what is happening. These tests are coming up, very convenient tests with good performance, but not great performance, and 95% accuracy. So what that's saying is we have tools. The immunity that Sven talked about, for instance, in Iceland, it's much, much greater for some reason. And it was almost all asymptomatic. So it's not clear exactly what's going on here. In Boston, you see large populations of asymptomatic people among, for instance, the homeless, which is surprising because they have lots of comorbidities. So I think you really have to take a resilience perspective on all of this. How do you organize yourself so that the errors that happen, the infections that are caught quickly and minimized? And how do you promote as much interaction as you can subject to that? And it requires not treating the whole population uniformly. It requires lots of measurement, lots of setting up systems to catch things easily, treat people based on their risk. And yeah, it's going to take a while to get it all right. And remember that there'll be the next one. So this is not a one-time emergency. This is something that we need to actually reconfigure the way we work, because it will happen again and again and again.
Very clear. Thanks, Sandy. Esteban, given that the measures we study, the social distancing measures, can be an important factor to fight the virus, one crucial element, as it was also clear from one of the first graphs you presented, is the time of their implementation. However, another crucial element is the time we start lifting these restrictions. Do you see, there are discussions about lifting these measures, especially because of their economic impact. How cautious you should be when we decide to lift this measure? What are the key parameters you should look in order to move to lifting this restriction?
Well, as I was saying, we are not gonna probably stop this thing. Sven and Sandy was talking about it. We are gonna live with this for a while. The question is what is the burden that we are gonna have in our health systems? Even though, I mean, some people are gonna be asymptomatic and some people are gonna be perfectly fine, even though they go through the infection. The problem is that we are having 500 people getting to the ER every day. And that's a burden that the health systems are not gonna, and that is creating also another second wave of things, like people not going to the hospital, not having chronic disease treatments, etc., which is gonna probably affect them in the long run. So what I'm trying to say is that since we are, I mean, from the epidemic point of view, we have to probably live with this for a while. The question is, if we lower the burden in the health, let's say in our health system below some threshold that can be maintained, then we can start thinking about leaving this first hammer phase and start the dance part. But it's also a balance between what we want on the epidemic side and what we want in the economic side. The only thing that we can say is that we have simulations about models, and probably you have seen other people doing the same thing, other models. Most of the simulations and the models suggest that we have to keep what we have right now because we are probably in the peak of the infection right now, but we have to lower still the number of people going to the ER. So I think we are not ready to lift to reconnect our society. But at some point, we will have to have a trade-off between both of them. And we have to decide as a society also, which is the level that we are going to meet in the hospitals and the level of people that we are going to meet to work.
Thank you, Esteban. Sven, final question for you, because we are approaching the end. What are the consequences to integrated global supply chains, especially manufacturing? Will regional integrated supply product chains emerge? It's a question from the audience.
Yeah, so this question about globalization comes back a lot. There's a little bit of noise in that conversation and maybe some truth. The old globalization story pre-crisis was that global trade was growing faster, twice the rate than GDP. That already stopped 8 years ago. So the old globalization story was gone already 8 years before this moment. And what was left is regional growth in trade was faster than GDP. What did, however, globalize also in the last 8 years was information flows, financial flows, and ideas. In this event, actually ideas are flowing globally faster than they've ever done. Communication is flowing faster than ever has done. Capacity for communication is being built like no tomorrow. And the masks for many countries are coming from China. So before we read the rhetoric wrong into sort of a divide, let's also look at how much the world is still currently helping each other. What is true is that factories in China are not working always because they need to get parts from Italy, from lockdown factories. So it's not only the dependence, there's a lot of the dependence on Asia-China discussion in this thing. And there's some historical technology discussions, that have been played just before this crisis. My hope is that people will hold the notion of how big the innovation is, how big the collaboration actually is in reality. And that will mean that from a supply chain perspective, people will look to reduce single point of failure, but not take that out on one particular geography.
Thank you very much. It's an important point to consider. We are run out of time. I would like to thank all the three of you for the great insights and for the great discussion we had. Let's hope the best for the future, and all the best. Goodbye, and hope to see you soon again. Take care.
Thank you.